Let's go to a facelift. Now, you hear the word facelift.
Yeah, it's scary.
What do you do with a facelift? What does that mean?
A facelift really is not as simple as it sounds. Most folks think of lifting a face and pulling somebody really tight, and they conjure up bad images that they've seen of some of the stars out there who've gotten some strange looks. Really what you're interested in doing is not only removing some of the loose skin, but the real work of the facelift is done underneath, where we want to reposition fat pads, where we want to tighten muscles of the neck, and then take the extra skin away. So we're not depending on that skin to pull that face tight. We're depending on redoing and repositioning. That's right.
Now, if it's a facelift, is it from here down, or is it from here up, or where are you lifting, or where are you working under the skin?
That's often confused. Facelifting per se is really the middle part of your face here and your neck. So this lower 2/3 of what you see is a facelift. This is all brow and eyes up here.
Where do you make the incision?
Incision for the facelift, we try to hide them as well as possible. We follow the contours of the ear, okay, around the front, and then we go into the temple up here so we can get some pull in this direction, pull this direction into the ear, and then the seam, if you would. I'm nothing but a glorified seamstress. we're going behind the ear and then back along or within the hairline. So everything is being shifted backwards and lifted up. So we have to have a seam, just like a suit maker or a seamstress would have a seam.
The suture in itself, is it a real fine suture? How do you know, where does the expertise come in making that incision so fine where it's hard to see later on?
I think it's incision placement is key, number one. You mentioned that. The number two thing is how you stitch the underlying tissue. And we use dissolvable sutures that are in the dermis of the skin or just underneath the surface, that are the holding sutures. They really give you the strength. And then the stitches on top of the skin, the really fine sutures, are just put in more or less just as a security layer for us.
In the face, if I try and lose too much weight, I get sunken right in here, and I call it a skeletoid look right there. And what do you do in people that have sunken in cheeks right here?
Yeah, I think number one, you try to get them to gain a little weight back. But number two is, more often than not, the loss of volume that you have in the middle of your face is because the fat pads of the face have descended or fallen. Well, if you reposition that fat pad up into its appropriate spot, you get a lot of that volume back into the cheek area.
You see a lot of people with little, I think we used to call them jowls.
Jowls, yeah, absolutely.
Right here, and so is that the fat that's falling?
That fat pad falls down, and that's, as we mentioned a bit earlier, that's part of the deep work that you want to do in the face. Now, there are some people who need more fat, so you can do fat transfers now, where you actually steal fat from one area of the body and inject it into this area. There are also cheek implants that you can put in if somebody wants a really full cheek. But you have to choose those people very carefully, because you, again, don't want that overdone look. We want a really nice natural look. I'm interested in making the patient look 10, 12 years better. Okay, that's it. I don't want them to look like somebody else.
Yeah, and just fascinating listening to you talk about, designing the work and going under the skin, where, somebody like me would go, oh, you just lift it up.
Yeah.
It really takes skilled work in knowing what to take away and what to put up and what to push around. How about the little, what do you call the little skin that falls down under the chin?
I think I call it a turkey gobbler.
Yeah.
A lot of folks in this part of the country call it that. And that's a combination of a couple of things. Sometimes it's extra fat. Sometimes, again, it's about the bands in the neck. You can see the bands that happen. The muscles in the neck loosen as we age. So those two things combined, a little extra fat, little loose muscle, all of a sudden loose skin, you've got the turkey gobbler.
Pretty easy to fix?
I wouldn't call it easy, but it's part of the facelift, so it works out very well.
Good. And so with the facelift, you can manipulate fat, you can redesign where you look about 10 or 12 years younger.
That's the goal.
And get rid of the turkey gobbler.
Pretty good day, yeah.